Well, you probably notice it. The season's cold air means our skin and scalps are more prone to dryness and irritation. But some simple changes could help lay the foundation of a protective barrier.
Yeah, that's right. Dr. Dhaval Bhanusali joins us now with some tips to keep your skin and your hair nourished all winter long. And we're starting to feel this weather, I'll tell you what. Nice to have you with us. Nice to have you back.
Thank you for having me.
All right, so let's talk about it. When it comes to moisturizing skin, what do you suggest as we head into these cold months?
Sure. So we touched on a little bit when we talked about fall changes, but not with the winter. I'd kind of pack away the gels and light lotions and switch to thicker creams or even petroleum-based products like a Vaseline or Aquaphor.
Okay, so you say it's not just what we put on our skin, but how we manipulate the cold, dry air around us. What do you mean by that?
So this is one of those ones where, when you're younger, your parents give you, they do things and you kind of roll your eyes. I remember my mother used to put a humidifier in my room, and I hated the sound of it, and I often complained, but she was right. Humidifiers are a great way of maintaining moisture in the air around you, and they're great for preventing that dry skin when you wake up in the morning as well.
I used to have that big Vicks one. I don't know, it was blue, and it just traumatized me. All
exactly, right. But moms are right. What can you do?
They are. Okay, let's talk about our lips. Chapstick, you're saying, is not enough.
Chapstick's a great thing, and using any kind of emollient-based product is always a good idea, except it might not be enough sometimes. And what I like to do and recommend to my patients, you put a little bit of hyaluronic acid on your lips ahead of time, and then put the Aquaphor or Vaseline, whatever thicker product you have, on top of your lips afterwards. And that hyaluronic acid acts like a sponge, so it maintains that moisture at that skin barrier level and prevents the dryness throughout the day.
All right, so let's move on to our hair. How can we tell the difference between dry scalp and an actual medical condition?
Sure. So, there's conditions like psoriasis, which have those thicker, sometimes painful, itchy scalps, and you can have lesions on the back of your head or on your elbows. With something called seborrheic dermatitis that we see almost every day, you have that greasy scale. It could be a little bit itchy. You might have some dryness in your eyebrows or right around your laugh lines. And you can have just dry scalp, which is usually just a little bit of irritation, a little bit of just itchiness, but kind of nondescript. So it's important to try to designate between them. And if it's very severe, to go see your dermatologist.
All right, dry shampoos, they've been recalled over their potential cancer risk, but you say we should limit our use either way.
Yeah, I mean, the cancer risk, the data is still early, so we're kind of monitoring it and seeing, what the true risk is. But we don't like it for other reasons. Those little fibers, they can attach to your hair follicles and over time cause damage to them and breakage and even hair loss. So I tell my patients 1 to 2 times max per week. And New York, I'm sorry, I know a lot of you use it a lot more often, but we want to prevent a lot of issues that you might have down the road.
Okay, so hair oiling is trending all over TikTok. What exactly is it, and are you a fan or not?
Plus or minus. So hair oiling, it's not a bad thing. There are different oils you can use, argan oil, coconut oil. What I tell my patients is this. Coconut oil specifically, if you have that greasy scale, that seborrheic dermatitis and a bit of dandruff, I wouldn't recommend it. Argan oil I do love for the hair follicles and to give that shine and sheen that people really want. Rosemary oil has been shown to help with hair growth. So there are a lot of good options, but just have to be careful with which ones you pick.
All right. Hair masks, what do you think about those? I feel like there's masks for everything these days. Hair.
There are. There are. But, it's one of those things where I do like them. I think it's a good option for kind of bringing the hair back to life. It doesn't really treat any condition per se, but it's a good thing to do once a week. I tell my patients on a Sunday, if you want to change it up a little bit and again, get a little bit more energy into the scalp, I do recommend a hair mask, from time to time.
So you mentioned for moisturizing, using like a heavier cream or something like that. What about exfoliating? Should you be doing that now that we're transitioning into the colder months?
Unless you have really oily skin or acne-prone skin, generally now you can skip it or maybe once a week. Usually I recommend 2 to 3 times a week max anyway, so not every day. But now I like to minimize everything, and the key to good winter skincare is simplicity. So less is more sometimes.
Oh, right. I love that. I love less of having to do all of those things. I feel like we add these things onto our day and then wind up never getting them done.
And everything else.
Dr.
Not
Bhanusali,
for me.
Nice to see you as always. Thanks for joining us again.
Thank you so much. Take care.
All right, you too. Well, for more skin and hair tips, you can follow Dr. B on Instagram at Dr. Bhanusali.